So you hear about all these different treatments for pain, right? But what if one of them, using just a simple needle and no drugs, might be a game changer for some really severe conditions? We're going to dive into a fascinating study on dry needling to see what the science actually says.
Okay, let's start with a number, 72%. Just let that sink in for a second. That's how many stroke survivors, according to one study, can end up with this awful, intense shoulder pain. It's a huge number, and it really sets the scene for the problem these researchers were trying to tackle.
All right, so let's dig into that problem a little more. You know, after someone has a stroke, the road to recovery can be incredibly tough. And one of the biggest roadblocks they face, it's pain.
And we're not talking about just a little ache here. This is something called hemiparetic shoulder pain, and it can be so bad it just stops physical therapy in its tracks. I mean, can you imagine trying to get your movement back when every single motion is pure agony? It's a massive barrier, and it doesn't just mess with physical recovery, it takes a huge emotional toll too.
So, with this huge challenge in front of them, a team of researchers back in 2004 started thinking outside the box. They wanted to see if there was a solution that went beyond the usual treatments. And that's when they turned their focus to a technique called dry needling.
And this really gets to the heart of their research. The big question they were asking was, could this super targeted therapy, using only needles, actually give people more relief than the standard treatment they were already getting? Was it the missing piece of the puzzle?
Okay, so what in the world is dry needling anyway? Well, it's pretty much what it sounds like. A physical therapist takes these super thin needles, kind of like acupuncture needles, and inserts them right into those tight, sore knots in your muscles. You know, the spots we call trigger points. And here's the key part. Nothing is injected. That's why it's called dry needling. The whole idea is that the needle itself helps release that muscle tension and, hopefully, relieve the pain.
All right, so having a cool idea for a solution is one thing, but you've got to prove it works, right? So to get a real solid answer, these scientists had to set up a serious experiment.
So here's what they did. They got together 101 stroke survivors, all of whom were dealing with this pretty bad shoulder pain. And they had them take part in a 3-week trial, 21 days to see what would happen. Now this is the really clever part of how they set it up. They split everyone into 2 groups. The first group was the control group. They just got the standard physical therapy. But the second group? They got that same physical therapy plus sessions of deep dry needling. This is so important because it let the researchers see exactly what difference the needling itself was making. And the process was super straightforward. Step 1, they got a starting point by having every single patient rate their pain. Step 2, they started the treatment. Remember, both groups got standard therapy, but only the test group got the extra dry needling. Step 3, they tracked everyone's pain levels along the way. And finally, step 4, they compared all the results at the end. Super simple, so they could see black and white what difference the needling made. Okay, so this is the moment we've been waiting for. After those 21 days of careful tracking and comparing, what did they actually find? Well, the results started to paint a really clear picture. So first things first, the standard therapy did work. I mean, both groups said they felt better by the end, which is great. But, and this is the big but, the group that got the dry needling, their improvement was way bigger and it happened a lot faster.
And you can really see it in the numbers. Look at this. At the beginning, both groups were hurting pretty bad, rating their pain around an 8 out of 10. By the end, the standard therapy group got down to a 5. Not bad. But the dry needling group, wow, they dropped all the way down to a 3.2. That is a huge difference in how much pain people were feeling day to day. The researchers even came up with an effectiveness score to make it even clearer. And again, the data is just night and day. The dry needling treatment was seen as almost 60% effective. Standard therapy on its own, less than 38%. That's a massive gap.
But you know, it's not all about pain scores. What really matters is quality of life, right? So they asked patients a really simple question. Did you sleep well? In the standard therapy group, about 3/4 of them said yes. But in the dry needling group, it was 93%. That's incredible! Less pain meant better sleep, and as we all know, good sleep is absolutely vital for any kind of recovery.
And you don't have to just take my word for it. The researchers themselves put it perfectly in their conclusion. They said that adding dry needling to standard therapy may improve the outcome. It's a pretty direct and confident statement based on all the evidence they gathered.
Okay, so let's zoom out a little bit. What's the bigger picture here? What should we really take away from all this? What's so interesting is that the benefits weren't just about one thing.
It was a whole cascade of positive effects. The study found that dry needling didn't just lead to less pain, it meant patients needed fewer painkillers. It helped them get back to sleeping normally. And maybe most importantly, because they weren't in so much pain, they could actually stick with their physical therapy. It created this amazing positive feedback loop for their recovery.
Now, any good scientific study will be honest about its own limits, and this one was no different. The researchers pointed out that it was a pretty small study, and it wasn't blinded. What that means is the patients knew if they were getting the dry needling or not, and sometimes just the belief that a treatment will work, what we call the placebo effect, can have an impact. So that's why they said, hey, these results are really promising, but we need bigger studies to be 100% sure.
And that really leaves us with a big, exciting question to think about. The study looked at one very specific, very severe type of pain. So if this simple, drug-free technique can provide this much relief in a situation like that, well, it makes you wonder, doesn't it? What other kinds of chronic pain, what other conditions could this potentially help unlock for people? It's a question this research makes you really want to see answered.